There is something I want you to understand before we even begin, because it completely changes how you look at your health after 60. Most people believe that when something goes wrong with the heart, it's because of obvious reasons. Poor diet, lack of movement, maybe years of stress. And yes, those things matter. But over time, I've seen something else. Something much quieter. Something that doesn't get talked about nearly enough. And that is this. Sometimes, the very things meant to help your body can, under certain conditions, begin to work against it. Not because they are bad, not because someone made a mistake, but because the full picture was never considered. I've seen people do everything right. They followed instructions, took their medications exactly as prescribed, stayed consistent, trusted the process, and still, something didn't feel right. Fatigue that didn't go away. A sense that their body wasn't functioning the way it used to. Small changes that were easy to explain away at first, but over time became harder to ignore. And what makes this difficult is that these changes don't appear suddenly. They develop slowly, quietly, gradually, so gradually that you begin to accept them as normal. Maybe this is just age. That's what I hear most often. But here's the truth. Many of those changes are not simply age. They are the result of interactions happening inside your body, interactions that are rarely explained in a typical appointment. Today, I want to walk you through something that most people never get a chance to understand clearly. Not to create fear, but to give you awareness. Because once you see the full picture, you can begin to ask better questions. And better questions lead to better decisions. Let's start with something very simple but extremely important. Your body does not process medications the same way at 60 as it did at 30 or even 45. This is not a flaw, it's a natural shift. Your kidneys, which are responsible for filtering substances out of your body, become slightly less efficient over time. Your liver, which processes and breaks down many compounds, works at a slower pace than it once did, and your overall system becomes more sensitive to changes in balance. Now, none of this is dramatic on its own, but when you combine it with something else, multiple medications taken at the same time, the situation becomes more complex. Because each medication is tested individually, approved individually, designed to perform a specific function. But what is rarely studied in depth is how multiple medications interact together in a system that is already adapting to age-related changes. And this is where things become important, because your body is not processing one input. It's processing several at once, each with its own effect, each requiring its own adjustment. And over time, that creates a kind of internal workload that most people are not aware of. This is why so many people feel off without being able to explain why. It's not one thing, it's the combination. I want to introduce you to a pattern that I've seen many times, and it often begins in a very similar way. Someone feels slightly more tired than usual. Not enough to be alarming, but enough to notice. Then, over time, that fatigue becomes more consistent. Sleep doesn't feel as restorative. Muscles feel heavier. Thinking feels just a bit slower. Nothing dramatic. Nothing that points clearly to a single cause. And when they bring it up, the most common response they receive is simple. This is normal. And that's where the problem begins. Because once something is labeled as normal, it stops being investigated. It stops being questioned. And over time, it becomes accepted. But what if it's not normal? What if it's a signal? A signal that something in your system is not functioning the way it should. Not because of a disease, but because of an imbalance. This is why looking at the full picture matters. Not just one symptom, not just one result, but the combination of everything that's happening inside your body at the same time. Now let's begin with the first category that affects millions of people. Medications designed to manage cholesterol levels. These are widely used, widely studied, and in many cases, very effective. They have helped reduce risk in people who need that support. But what is rarely discussed in detail is how they work beyond their primary purpose. Because when a medication blocks a pathway in your body, it rarely affects just one thing. It affects everything connected to that pathway. And this is where understanding becomes important, because your body relies on interconnected systems, not isolated functions. When one part is influenced, others are affected as well. And while this may not create immediate symptoms, over time, it can influence how your body feels and functions. This is why awareness matters. Not to avoid treatment, but to understand it fully. Because once you understand how something works, you begin to see how it fits into the larger picture of your health. Now let's go deeper into the first category, because this is where things start to connect in a way most people never hear explained clearly. Medications used to manage cholesterol levels are among the most commonly prescribed, especially after 60. And again, I want to be very clear. In many cases, they are necessary and beneficial. They are not the problem by themselves. The issue is what happens alongside their primary effect. Because when your body blocks one pathway, it doesn't isolate that action. It affects everything connected to it. And this is where one specific element becomes important. Something your body naturally produces. Something most people have never heard about, yet something your heart relies on every single day. That element is CoQ10. Now, you don't need to understand the chemistry behind it to understand its importance. Think of it this way. Every cell in your body requires energy to function. Your heart, more than any other organ, depends on a constant supply of that energy. It doesn't rest. It doesn't pause. It works continuously, every second of your life. And for that to happen efficiently, it relies on a stable internal fuel system. CoQ10 is part of that system. When levels are consistent, your heart functions smoothly. When levels begin to drop, even gradually, your system adapts, but not without consequence. And this is where patterns begin to appear. Not dramatic changes, but subtle ones. A feeling of fatigue that doesn't fully go away. Muscles that feel weaker than expected. A sense that your body is working harder than it used to, even when your routine hasn't changed. And because these changes develop slowly, they are often accepted as normal. But when you step back and look at the pattern, the connection becomes clearer. This is not about one medication being bad. It's about understanding the full effect so that your body can be supported in a more complete way. Now let's move to something that almost everyone has used at some point, and many people rely on regularly without thinking twice about it. Over-the-counter pain relief. It feels simple, accessible, familiar, something you can take without much consideration. And in occasional use, that may be perfectly reasonable. But the pattern changes when it becomes part of your daily routine, because what feels like a simple solution on the surface interacts with your body in a much more complex way underneath. These medications influence how your body manages inflammation, but they also influence how your blood vessels function. And this is where things become important. Your blood vessels are not just passive tubes. They actively regulate how blood flows through your body. They expand, they contract, they respond to signals that keep everything balanced. And when that balance is influenced repeatedly over time, your system has to adjust. Not dramatically, not in a way you feel immediately, but in a way that builds gradually. This is why some people begin to notice changes they can't fully explain. Slight increases in pressure. A feeling that their body is more reactive than it used to be. Again, nothing extreme, nothing that clearly points to one cause. But when you look at the full pattern, it becomes easier to understand. This is not about avoiding something completely. It's about recognizing how repeated use changes the way your body responds over time. And once you see that, you begin to approach it differently. Now let's talk about something that surprises almost everyone when they first hear it, because it doesn't look like it has anything to do with the heart at all. Medications used for digestive comfort. These are often taken daily, sometimes for years, without much thought. They provide relief, they become part of the routine, and over time, they feel completely normal. But what's rarely explained is how they influence absorption inside your body. Your digestive system is not just processing food, it's regulating what enters your bloodstream. It decides what your body receives and what it doesn't. And for that process to work properly, certain conditions need to be present. When those conditions are altered over long periods, even slightly, it begins to affect how your body receives essential nutrients. And this is where the connection becomes important, because your body relies on those nutrients for functions that go far beyond digestion. They support your nervous system, your circulation, your overall balance. And when absorption is reduced over time, your system adapts, but not without consequence. This is why some people begin to notice changes they can't explain. Fatigue that doesn't respond to rest. A gradual shift in how their body feels day to day. Again, these are not sudden changes. They develop slowly, quietly, and because of that, they are often overlooked. But when you understand the connection, the pattern becomes clearer. Now we move into one of the most complex areas, and at the same time, one of the most important, medications that influence how your blood behaves. These are prescribed for very specific reasons, often to prevent serious complications. And when used properly, they can be life-saving. But here's where the conversation becomes more nuanced, because your body uses multiple systems to maintain balance, and when one system is influenced, others are affected as well. In this case, your body relies on certain nutrients to regulate where minerals go and how they are used. When that process is influenced over long periods, your system adapts in ways that are not always obvious. This is not something you feel immediately. It's something that develops over time. And because it's gradual, it rarely becomes part of the conversation. But from a broader perspective, it becomes an important piece of the overall picture. This is why awareness matters. Not to change anything abruptly, but to understand how different factors interact over time. Because when you see the full picture, you begin to ask better questions. And those questions lead to better decisions. And now we come to something that has been recommended for years. Something that many people take daily without a second thought. Supplements intended to support bone health. These are often seen as simple, beneficial, and completely safe. And in many cases, they do serve an important role. But like everything else we've discussed, context matters, because your body does not process everything in isolation. It integrates everything into a single system. And when certain elements are introduced without the balance your body expects, it responds in ways that are not always obvious. This is where understanding becomes critical. Because the goal is not to avoid something that can be beneficial. The goal is to ensure that it works within your body's natural system, rather than against it. And this is where many people benefit from a more complete approach. Not more complexity, but more awareness. Because once you understand how your body integrates what you give it, you begin to see why balance matters more than anything else. So here's what I want you to take from everything we've covered today. This is not about fear. It's not about avoiding necessary treatments. It's about understanding that your body is a system, not a collection of separate parts, but a connected whole. And when you introduce something into that system, it doesn't act alone. It interacts with everything else that's already there. This is why two people can follow the same routine and have completely different experiences. Because their internal systems are different, their patterns are different, their combinations are different. And once you begin to understand that, you stop looking for simple answers and start looking for complete ones. You begin to ask better questions. Not, is this good or bad? But how does this work in my body? And that shift changes everything. Because it puts you back in control of your own understanding. It allows you to have more meaningful conversations, make more informed decisions, and support your body in a way that is consistent and sustainable. And that's the goal. Not perfection, not extreme change, just awareness, consistency, and balance. Because often, the difference between feeling stable and feeling uncertain comes down to understanding what's happening beneath the surface. And now, you're one step closer to that understanding.